Hi everyone, it's Lisa. I am doing my 2-week post-op video. It's actually been 2 weeks and a few days, like 2 days, since I had my upper jaw surgery. I went ahead and left my rubber bands in, even though it's kind of hard to talk with them, so you could see the rubber bands that I'm wearing that are not very fun at all to wear rubber bands. They're super tight. Okay, so I'm going to start off by just kind of explaining what was done to me with my upper jaw surgery. I had what they call a Le Fort 1 osteotomy. However, my skeletal deformity was in the back of my upper jaw. They shaved down about 3 millimeters in the very, very back on both sides of my upper jaw. The front of the maxilla of my upper jaw was fine. They kind of just had to even it out because the back was too long. And that's why my lower jaw had problems my whole life with my lower jaw, which grew fine, finding a comfort spot with my upper jaw as far as the occlusion goes. So anyways, this has been a long journey for me if you haven't seen my last videos. It's been about 7 years of trying to figure out 2 years to figure out what was causing my pain, my headaches, my earaches, my lockjaw, my neck locking. Then finally when they checked my occlusion and realized that it was severe, I didn't even know what that meant. I started my journey with trying to fix the occlusal disease that I had, which is what they call it. Some call it TMJ, some call it CMD, some call it occlusal disease. But anyway, so finally I was diagnosed with the skeletal deformity after 3 years of splint therapy, the second time around. So if you want to watch my old videos, you can get in a more detailed video about all of that. So 2 weeks of this upper jaw surgery. My upper jaw was also moved forward a little bit. And I'm finally feeling like things are going up. Things are getting better. The first week is very difficult, like I've said. And then my oral surgeon said that after week number 2, I'll start feeling like I'm human again. So I do feel like I'm human again. It's still weird to kind of like go outside because of my eyesight. My eyesight got really blurry, and I think that's because of the muscles that guard your injury. They all get really super, super tight. My eyesight has gotten better. So it is still kind of strange to go outside and to be in public because I'm always scared someone's going to hit my face. So I haven't really been out too much. But I am starting to do little things around the house, like clean the kitchen, which does make me feel like I'm human. Okay, so this is my bite now. This is about as much as I can smile because my upper lip is still swollen, and of course all up here is still swollen. I'm very tender right here, and all up in here on this side. I'm better on this side, but my bite does come together again, as you can see. It's not perfect because I still have to go back to the orthodontist, and he still has to do a lot of stuff. So I still I hit on both sides, but not evenly yet. But that's obviously going to be a work in progress. So, so what can I eat? I can't really eat. I can now start having some mashed potatoes, and I can cut up macaroni and cheese really finely, but it takes me a long time to eat even just like a small bowl of macaroni and cheese. I'm still doing syringes just because I can get more in my system quicker, and I have 2 children, so that seems to be working better for me. and I can put all kinds of stuff in my protein shakes. But I can like have applesauce and eggs, but I don't like eggs, but I can do eggs. Like I said, these things are very difficult to eat or to swallow because you're kind of pushing it in the back of your throat and swallowing it. So it's doable, but it does take some time, and that's why you have to still kind of relax and take it easy at home because it takes time to eat. You do want to try to have applesauce and yogurt and stuff like that because he wants me to try to use my jaw just a little bit. Pain. Oh, pain. I'm not taking the pain medicine or ibuprofen. I take the Tylenol with codeine at night only, and I think I'm almost out of that, so I don't think I'm going to be renewing that. And then I take ibuprofen during the day as needed, so that's where I'm at with pain. It's still painful up in here because I have a stitch that runs all the way up on my upper gum, and it comes into both my nostrils as well, the stitch. So it still burns and it's still obviously swollen, so I'm still in some pain, but not a lot. The most painful thing are wearing the rubber bands because they're pulling on your teeth and you have your steel wires in, and it hurts, and that's not fun. So I take ibuprofen for that. I do have a lot of muscle tightness. I have muscle tightness all in my neck and in my traps and my SCM and my splenius muscles in the back of the neck, and of course all in your head, which are your pterygoids, your masseter, your buccinator, I think that's called, and then you have your temporalis, which is a very, very important chewing muscle right here on the side of your head. Those are all super, super tight, which can cause some symptoms. Symptoms meaning ear pain, headaches, which I know how to deal with the muscles, so I haven't really I have a little bit of head pain, but I've been able to get rid of it because I could deal with massaging the muscles because I know how to do that. I don't massage my face at all. No, don't touch the face. I do get into my neck and my back because I can. And I kind of do the temporalis a little bit, but the temporalis muscle attaches underneath here, and it's very close, obviously, to your injury. So you don't want to loosen that up just yet because these muscles are guarding your injury. So you have to be very careful with that. But a lot of muscle tightness, which can lead to symptoms that are uncomfortable. Oh, goodness. So in the very first week of surgery, my very first appointment with the oral surgeon, I forgot to mention in my last videos that I had thrush. Very, very important for you to try and take a probiotic if you can somehow in your shakes, in your applesauce, to counteract the antibiotic, because the antibiotic killed all of the good bacteria in my mouth, and I ended up having thrush, and so I had to be on medication for thrush, and basically your throat gets sore and everything gets really white because yeast and fungi will grow in your mouth. Yay. So just be aware of that after you have surgery, so that you can get a prescription. They're like dissolvable tablets that go in your mouth to kill the fungi so that you can swallow the liquid diet that you're on, because otherwise it burns. So be aware of that. I wish I was aware of that, but I got through it. I'm okay now, and things are getting better. Okay, iron supplement. I take Floridex, which is a liquid iron. I'm used to it because I took it when I was with both my pregnancies, and it's just obviously you are going to possibly be susceptible to anemia. So if you feel it's necessary, I like Floridex for an iron supplement. Liquid vitamin. You can get many kinds of liquid vitamins. They're nasty, most of them, but it is important to keep yourself healthy as healthy as you can. It's very difficult, obviously, especially if you have a bunch of rubber bands in your mouth and you're syringing. It's really hard to keep the nutrients that you need to heal. So you have to get creative and figure out ways to do that. And I recommend a liquid vitamin that I did every day. I did do like a protein shake, which has got like mangoes and peaches and plant protein. And then I would put, my husband would actually do it. I would put flaxseed oil and, some other stuff in there. Right now, I'm starting to go back to my other supplements, like a B100 complex, but I'm crushing it and I'm putting it in the protein shake as much as I can, because it really does make things pretty nasty when you crush up supplements and put them in like applesauce. It doesn't really taste well. So I'm starting to do a little bit of supplements now, again, along with the other ones, to try to get my body, if I have any deficiencies, back up because of the lack of food intake. So definitely recommend trying to get creative with that and do some research on it if you need to try to make sure that you are as healthy as you can be. And syringe a lot of water in your mouth. And I'm able to drink water now through a water bottle with a straw. So that's good. Oh, another good thing to drink that has a lot of nutrients in it is called Suja, S-U-J-A. You can get it at Publix, like by the, what's the other one? By all of the, like the orange juice and stuff like that. It's called Suja, and it expires pretty quickly, so you have to drink it as soon as you get it, pretty much. But they have a Green Delight one that's got a lot of greens in it, and I drink a lot of those to help me to heal and get lots of rest, which is really difficult when you have these rubber bands in your mouth and you're in pain, but try as much as you can to get rest. I go to the oral surgeon on Thursday to do another checkup. He does a checkup every week. And then I don't go back to the orthodontist for another couple of weeks, which I don't want to, because I'm still very numb. I can have feeling in here, but I still can't feel my upper teeth at all. And so that kind of scares me to go back to the orthodontist and have him like pull stuff up in there. So I'm not really rushing going back. Other than that, I'm just hanging in there and trying to think positive about being able to eat again. Because the whole reason why I did the surgery was because I couldn't eat before, because I only had one tooth contact. So I was on a soft food diet for a long time before this. So I'm hoping that in another few months, as I work with the orthodontist and get this thing, my teeth all in the contact evenly, that I can start to eat. And I'm hoping that I'll be able to smile again soon with my teeth together, have a normal smile. Most importantly, I would just like to eat regular food. So that's my update for now. I guess if you have any questions, I haven't really checked my YouTube, but I will once I start to have some more energy. Check my YouTube and answer any questions that you guys may have. And I will talk to you again. Okay, bye.